Hi, mamas. It's Elle again. Today we're going to be talking about my third birth. And this for me was my most difficult labor, which actually led to my desire to do this program to help moms. So let's back up and talk about it. If you remember birth number two, for me, it was wonderful. Honestly, my best birth, very spiritual, and also very medicalized. And that was not my approach with my first daughter. My first daughter was fairly natural leaning. I wanted to birth as long as I could at home, or excuse me, I wanted to labor as long as I could at home. I had a nurse midwife instead of a physician. Um, I didn't get an epidural, not until 24 hours into labor. So it was something that I really wanted. Um, but it didn't work for me. It just didn't work with my body, with what I needed. It just didn't work. So with my second daughter, I went very medical and I got induced epidural pretty early on, and it was great. It was wonderful, no complaints at all. But on to my third daughter, I thought, okay, the second one was so wonderful. Let's do it again. I had the same physician, I went to the same hospital, and I even got it induced again. The horrible thing, though, my red flag, was that when I got to the hospital to be induced, same thing as last time, right? I got my toenails done with my mom and my sister, and my mom dropped me off at the hospital and took my two older kiddos who were 4 and 2 at the time, and she was going to watch them. And I prefer to labor alone early on. I don't particularly like having a birth partner until I'm ready to push. It's just my own preference. So I went into the hospital, and as soon as I got there, and remember, I was dropped off, so I didn't have a car with me. I go to the front desk and say, I'm here to be induced. And they look in their calendar and they say, no, you're not. You're not on the books. And I was like, yes, I just had an appointment a few days ago and I was there and my doctor called. I actually heard the phone call. And so they said, okay, well, we're actually full and we can't do an injection. And she said, let me call your doctor. So she called my doctor. She got back to me and she said, I'm sorry, we were mistaken. It just got misplaced. Come on in, and we're going to induce you. At that point, I felt pretty uncomfortable. If she's telling me they're already full and there were these issues, I wasn't really wanting to do it. But, I thought, okay, I already made the stink. They already called the doctor. So I'm just going to do it. Just going to go along with it. It'll be fine. So go along with it. They pull a nurse out of postpartum care. So she had trained before in labor and delivery, but she was not a labor and delivery nurse. And she appeared to still have some patients in postpartum when she was caring for me in labor and delivery. So I get started the same as normal. Um, I get Pitocin, I get other things right in my cervix. So I'm just, doing whatever, pain's kicking in. And again, I like to labor alone, so I'm just dealing with things. And the pain intensifies over time, and I'm to a 3. I'm dilated to 3 centimeters, and I asked my nurse for an epidural, which was in my plan. That's what I did with my second daughter because my body takes a very long time to progress from like a 0 to 3 to a 4. But once it's to that, it's within a half an hour the baby's out. And so if I lose that window, there's a good chance I won't be able to get my epidural. And she refused. She says, no, it's too early. And I said, well, will you please call my doctor? I've done this before. He's okay with it. And she said, no, it's too early. I was, I was shocked. I was truly shocked. It's like, well, I'm kind of vulnerable right now. I'm strapped to this bed. I've got all these monitors on, and I know that my doctor is okay with that. We've discussed it specifically with this child, and then I did it with my other. And I understand why generally you don't give mothers an epidural too early on. But in my specific case, it was my third child. We knew my body, and that's what worked for me. And it was my physician's decision. Um, shouldn't have been my nurse's, and it was. And I was completely unaware at that point in my life that you could separate from your nurse, that you could ask to speak to the charge nurse and then say, it's not working out between this nurse and myself, and I would like another nurse. I didn't know that. So I go on with things. I get horrible back pain. The whole pregnancy, I was measuring huge, 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 huge. He kept saying I was measuring like I was having multiples. And I had had a prior multiple pregnancy of triplets. So he kept looking for a twin. I had probably 4 ultrasounds looking for a twin because that's the way I was measuring. Little did I know I had too much fluid. That's probably why I was measuring so big. And my daughter's cord was short. But again, I didn't know that at the time. They didn't catch that in the anatomy scan. So, what did that lead to? It led to horrible back pain. Horrible, horrible, horrible. And the hospital I was at wasn't particularly friendly to more natural methods of giving birth. So I was on this table, or excuse me, on this hospital bed, strapped to everything, being forced to be on my back, especially because of the ripening of my cervix. I had to, they wanted me on my back. And I was just in so much pain. All I wanted to do was get on my hands and my knees and rock to try and alleviate some pressure on my lower back. And that just, it wasn't possible. So I'm going through a lot of pain. My water is bulging, and the nurse, they had a new policy in the hospital that the nurses were no longer able to artificially rupture the membrane and allow the fluid to escape. So to make your water break, right? And so I was in a lot of pain, and then my water just wouldn't break. It had been bulging for a long time, and it wouldn't break. And she said, "Well, we have to wait till your doctor can come in." So that was more pain. I had a lot of pain. My partner came in at that point. I was in so much pain. My nurse had refused to give me an epidural for hours at this point, and I was still at a 3 because that's the way my body rolls. I know my body. And she was nowhere to be found. My nurse had been gone, honestly, hours, and I hadn't seen her. And I was in active labor and in so much pain. My blood pressure was skyrocketing. The machines were going off, they were beeping alarms, and that made my blood pressure go even higher. And she was nowhere to be found. Probably about 30 minutes to an hour of that, another nurse comes in my room and kind of mad. And I don't think she meant to be grouchy with me, but she was. And she said, "Where's your nurse?" And I'm like, "I don't know. Why didn't you tell me? I'm kind of stuck. I'm in labor. I'm on this bed laboring by myself with all my machines going off because my blood pressure's through the roof because I'm in so much pain." Um, so finally, she comes up. They find her. They make her come in. And at that point, I have a birthing partner. And this is really where maybe it would have been beneficial to have a birthing partner before, because then he was able to advocate for me when I'm stuck to this bed. He was able to get up and move around and say, "Listen, she needs an epidural. She's in pain. Her doctor's okayed it. You need to call her doctor." So he did. My husband advocated for me and called my doctor, and he says, yes, she can have an epidural. So I think this is probably 15 hours in, 14, 15 hours in. Um, and there was at some point a change in nurse. So the nurse who started me in the first hour or two, she was gone. And the nurse that I was talking about was the one who was there for the labor and delivery. And she was there for the majority of it. I mean, I think I had her for her full 12-hour shift. So, 14, 15 hours in, she finally says, "Okay, you can have an epidural." She calls them in and she says, "Oh, there's a lot of moms that need epidurals right now, so you're going to have to wait your turn." Okay. So I have to wait. I'm in horrible pain, horrible back labor, which is the worst because it's not just contractions in your belly, your abdomen, your lower abdomen, it's your whole back too. And so it just feels like everything is squeezing, very painful. So finally, they come in, and the anesthesiologist, they do my epidural, but I was I mean, my contractions were bam, bam, bam on top of each other. So there really wasn't a time, like a window for them to get in there and give me a nice clean epidural. And I was contracting the whole time they were doing it. It was excruciating. I'm trying to, do the cat bend, and well, they stuck me, and they didn't quite get it right. It made mostly my upper abdomen, honestly, into my chest numb, and very little in my lower abdomen, very little in my pelvic area. And having had epidurals before, I knew that wasn't right. But I mean, at this point, now my body is to the 4, and it's rapidly progressing. I go from a 4 to a 10 like that. Um, and within a very short period of time, I'm pushing. One push might have been two. Um, you know, no, it was one push. I had one push, and the doctor kind of stopped. He was a former military man, and he said, "You need to push baby out right now. She's in distress." And he said, I didn't have a contraction, and he said, "You just need to push her out." And so I did, because remember, this whole time I'm in so much pain. My blood pressure's through the roof. My body is like in distress. And finally hers is too. And they had been giving me oxygen. And it was a really difficult pregnancy. I felt completely abandoned. I felt scared. I felt like, I'm getting emotional. I felt like I had no control, like that they didn't honor my body and my opinion. Um, and this is not what I wanted. So I'm scared. Again, remember my history. At this point, I had had two miscarriages. I had a miscarriage of triplets in between my first and second child. And then I had another miscarriage between my second and third. So miscarriage between first and second, and then miscarriage between second and third. And I actually struggled to get pregnant with my third child. And so that miscarriage was really hard. And then I got pregnant again, and I was very excited, my rainbow baby. But because of that history, I didn't really allow myself to feel connected or attached to her. Because again, until I had a baby that was out and had been out for a while and was viable, I didn't want to have to go through as severe a grief process as I did with that first miscarriage, which really it nearly destroyed me. It was difficult. And I can talk about that another time. So I pushed baby out. Baby's in distress. Baby comes out purpley blue. She's not breathing, and I'm thinking, okay, here it is again. Here it is. You know, my daughter. I'm gonna lose another child. Um, and nobody talked to me about it. I saw them whisk baby away. They have baby, and they're trying to get her to breathe, to cry. They're, vigorously rubbing her, and nothing for honestly a minute. Um, and then finally she had a weak cry. Um, and she was born, and they plopped her on my belly, and I got maybe 5 minutes of skin to skin contact, which is better than nothing, but it's definitely not the full hour to 2 hours. Um, and then they took baby away to clean her and test her and all of those things. And nobody talked to me. Nobody debriefed me. Nobody talked to me about what happened. I didn't fully understand. To this day, I don't fully understand. Obviously, I believe there was a problem with oxygen getting to her. Um, and as a therapist now, that raises so many questions for me. I'm like, was she, hypoxic, and did she have some damage? She, for example, as a child, scooted. She never crawled, and that's a sign of CP, cerebral palsy. Um, and I'm not saying my daughter has cerebral palsy, but I'm saying there's so many things that I was not aware of. I didn't really understand what had happened to her. I didn't understand the risks or what to look out for. Nobody talked to me about the mental health aspect, what that was like for me. And so I just, I just, I was completely traumatized. And that was supposed to be my last baby, and to end. to basically have this really difficult first labor and delivery and then this really difficult third just felt like it bookended something that should be a happy memory with something that was anything but happy. It was very traumatic. And I went home with high stress. And at the time, I didn't get diagnosed with it, but looking back, oh, I had PTSD. You avoiding doctors. I didn't avoid my daughter, but I didn't like going to doctors. I didn't like the way it made me feel anxious. I didn't like to leave the home. Um, I started getting panic attacks. I it was really a difficult time in my life. And I just, even to this day, I have these vivid memories of my daughter, just not crying, just being limp, being purpley blue, um, and just feeling absolutely helpless. And that is a feature of PTSD, those visually rich flashbacks and nightmares. And again, I mean, I've mentioned this in other places, but the reason why that is because when you're in a fight, flight, or freeze situation, an emergency, it helps your body to be able to assess, okay, I'm going to bring in more visual information. So I'm going to look around. I can see more things than I normally do. I can process more things than I normally do. And then, how far away am I from things? I'm calculating how far am I from the door? How far am I from the window? How can I get away? Or should I stay and freeze? Or, all of these other things. Should I fight? And so you get that fight, flight, or freeze response. And so having more visual and spatial information can help you escape danger. But the problem is when those short term memories, those visually rich short term memories, turn into long term memories. And then it's disorganized. And trying to process through all of that excess visual and spatial information results in some pretty horrific flashbacks and nightmares. And I did. I had horrible nightmares. I would wake up every day and tell my husband about the vivid nightmares I had, usually with children being brutally killed, and just very disturbing dreams. And I had no idea at the time that that was a sign of PTSD. And it wasn't until I went to OT school myself to find that out. And so I just really just kind of spurred this desire in me to help moms. I don't want moms to feel like that ever. I don't want them to feel alone and scared and then have nobody talk to them about what happened or give them any kind of insight or ask, "Are you okay? That was scary, Are you okay?" Nobody did that. And I think that's a real shame because once mom and baby are physiologically stabilized, you need to then psychologically stabilize mama because mama needs to be healthy 360 in order to care for her baby and recover from her pregnancy and labor. I mean, so really that's where I come in. That's where the happy birthday comes in, is trying to create these memories that are happy rather than traumatic and scary. I don't want anyone to look back like I did. But based off of that third birthing story, and going into my fourth, which wasn't a planned pregnancy, but it was our only boy, so it worked out. But he snuck in number four. I wanted two, ended with four, and I'm so happy. I love my children, and I'm thrilled. I'm so happy to have my boy. But when I went to have him, I went 100% granola. I'm talking birthing center, and this was a birthing center in Santa Cruz, which is actually in a surgical center, so they can do emergency C-sections if they need to, and they're literally just like down the street, not even a quarter of a mile from a hospital with a high level NICU. So it was I felt pretty good about the process, but that is a story for another day. The biggest thing is I had this great super medicalized birth and I had this horrific super medicalized birth. And I noticed what my mom had been telling me with my first child, that you don't want an epidural, you don't want those things, you want to be in control, and you want to decide what your body's doing. And when I had my second daughter, I was like, oh, hogwash, this worked out perfect for me. But after my experience with my third daughter, it was definitely like, okay, mom's onto something here, right? Like, I don't care. Personally, for me, I don't need it to be granola just because that's what I value. And I'm fine with having a medicalized birth, but for me, it was a matter of control. I didn't want to feel stuck or imprisoned, like anyone was making these decisions and disregarding me. I wanted to make decisions for my body and my baby, and I wanted those decisions to be honored, especially because those are decisions I'm talking about with my obstetrics provider. So for my fourth one, I had a midwife, again, a nurse midwife. But that's the thing, is those birthing plans are discussed, with your OB provider, and then when you get to the hospital, it's hard. It's, do they honor it? Do they not? And I've seen some suggestions for, rather than having a birth plan, having a birth flow chart, especially for moms who may have a traumatic birthing experience. Because if you have a birth plan and it's not honored, that can cause problems, if you're too rigid. And because health issues do come up. In the case of my daughter, the fact that her cord was too short, um, led to the fact, led to the excess fluid in my abdomen, in my womb, and um, it could have led to some other things. So when she went into distress, it was because her cord was so short and she was having a hard time coming out. And when she did come out, I got lucky because it could have ripped the placenta away from the wall of the uterus. It could have ripped the placenta in general and caused some hemorrhaging. So I got so lucky, and I felt that urgency. Women in giving birth are pretty attuned to what's going on and the emotions in the room. So I knew, with the way that the nurses were behaving and the physician, that things were tenuous. And just not talking about them didn't put my mind at rest. It made me more anxious. So that's something that I definitely support, is women having those decisions and being treated as more than an equal, as the owner of her body, and as a human who can make decisions for her body and her baby in conjunction with the physician and the nursing staff. But it needs to be a collaboration. Whereas my experience with my third daughter, it was not a collaboration. I felt like I was in prison. I felt like I was being told, sit down, shut up, you get what you get, and that's what it is. Um, and that is, in my opinion, not appropriate. From research, from literature reviews that I've done, I've seen time and time again that when women feel out of control, they are more likely to get PTSD, even if baby doesn't have to go to the NICU, even if there's not an emergency C-section, even if there's not a hemorrhage or something like that. That it is a matter of having mama be honored and spoken to like an equal, like a collaborator, and having that give and take discussion. So that is what I want to advocate for. And 13 months after this birthing experience for myself, I attended my sister's birthing experience, and she tried to have a home birth, and it went pretty bad, and she and her son almost passed away. They did get to the hospital. They did have a crash cart called for mom and then for baby. It was a scary situation. So I had my traumatic birth experience. 13 months later, my sister had hers that I was present for, and it kind of just mm, it doubled down in my mind the problems, mm, with healthcare. The, you know, I think healthcare is great, and we save moms and babies' lives, and that's so wonderful. There is room for improvement, and I think that occupational therapy is one of those things that can definitely help kind of bridge those divides. We're great generalists when it comes to therapy, the therapy professions. So we have a little bit of mental health, a little bit of physical therapy, a little bit of speech, swallow. We have a little bit of almost everything in regards to therapy professions. And so we can really get in there and we can see, okay, what's going on. Mom had a traumatic birth. I'm going to assess her for that. We're going to address her mental health. I'm going to address ergonomics. We're going to address all of these other things. So let's get OTs in there, right? Let's get OTs in there so they can come in and they can psychologically help stabilize mom and help her in any other way she needs to transition home, and giving her the best odds of being a happy, healthy mother with good attachment patterns, good parenting, good authoritative parenting patterns, and providing that baby as well as that mom with the best opportunity going forward. Thank you for joining me for story number 3. Next time we'll talk about number 4. Bye.